to light the way. Making nursing stupid simple every day.
Today we're talking about something every nurse needs to recognize fast: sepsis. Sepsis happens when the body's response to an infection goes out of control. Instead of fighting the infection in one area, the immune system starts attacking the body itself. When that happens, organs can begin to fail. Sepsis is one of the leading causes of death in hospitals, and the earlier you catch it, the better the outcome. So, what does sepsis look like? Fever is common because the body is trying to kill the infection with heat, but some patients run cold instead. Chills, shivering, or a low temperature can be just as concerning. Elevated heart rate means the heart is working overtime to move blood and oxygen to vital organs. Elevated respiratory rate means the lungs are trying to compensate, often by blowing off carbon dioxide to help balance blood chemistry. Confusion or altered mental status is a major warning sign. When the brain is not getting enough oxygen or blood flow, thinking becomes foggy. This can be one of the earliest and most important signs. Low blood pressure is especially concerning. As sepsis progresses, blood vessels dilate, pressure drops, and organs stop getting the perfusion they need. This is the beginning of septic shock. Decreased urine output is another red flag. The kidneys are sensitive to changes in blood flow. Less than 0.5 milliliters per kilogram per hour should concern you. Now, what does the nurse do? First, recognize it early. Do not wait for every sign. 1 or 2 findings in the right patient should raise concern. Second, assess. Get a full set of vitals. Check mental status, urine output, and oxygen saturation. Third, notify the provider immediately. Time matters in sepsis. Most facilities have a sepsis protocol, so know yours before you need it. Fourth, monitor continuously. Sepsis moves fast, so reassess frequently, not just once an hour. Here's your NCLEX tip. Sepsis questions test early recognition and priority action. The first action is usually assess and notify the provider. Do not wait for a diagnosis. If the patient looks wrong, sounds wrong, or the numbers are trending wrong, make the call. Bottom line, sepsis starts as an infection and becomes a system-wide emergency. Your job is to catch it early. Stupid simple. See you in the next lesson.
Quick recap. Sepsis is the body's out-of-control response to infection. Watch for fever or chills, fast heart rate, fast breathing, confusion, low BP, and low urine output. Altered mental status is one of the earliest warning signs. Notify the provider immediately. Do not wait for all signs to appear. Urine output below 0.5 milliliters per kilogram per hour means the kidneys are struggling. Memory trick. S. Shivering or fever. E. Extreme illness feeling. P. Pain or confusion. S. Shortness of breath. I don't look right. S. Seek help fast. When your patient says any version of, I just don't feel right, take it seriously. Pop quiz. A nurse assesses a patient admitted for a urinary tract infection. The patient now has a temperature of 102.4 degrees Fahrenheit, heart rate of 112, respiratory rate of 24, and is confused and restless. What is the nurse's priority action? A. Administer acetaminophen for the fever and reassess in 1 hour. B. Notify the provider immediately and prepare to follow sepsis protocol. C. Encourage oral fluids and reposition the patient for comfort. D. Document the findings and continue routine monitoring. Pause the video if you need time to think. Answer. B. The patient is showing multiple signs of sepsis: fever, tachycardia, tachypnea, and new onset confusion. These findings together indicate a systemic response that requires immediate provider notification and activation of the sepsis protocol. Treating the fever alone or waiting to reassess delays life-saving intervention. On NCLEX, when a patient shows signs of systemic deterioration, notify and act. Do not treat individual symptoms. All right, future nurses, so how did you do with today's lesson? If you felt stuck on a topic, don't stress. That's how you learn. Nursing school is all about repetition, practice, and building confidence one step at a time. Don't forget to grab your free cheat sheet linked below to help you review today's lesson. And if you want extra NCLEX-style practice questions, bonus rationales, memory tricks, and extended study sessions, check out my Patreon linked in the description for even more no BS nursing content. Make sure you like, subscribe, and turn on notifications so you never miss another stupid simple lesson. All right, future nurses, you've got this, and I'll see you in the next one.